I am going to bring a little bit different flavor to the presentation in the sense that I am the only member of the working group here. I'm going to give you the vital signs of what we see on a daily basis and add some reality to the situation here and perhaps be able to drive to some extent the reason why vaccinations become very important. I'm not sure whether or not today should be a sad day for me or a happy day, but what I am sure of, I'm pleased that this center is going to join in the fight with us as we fight with COVID diseases. Sad because it means that the need to have more capability and capacity means that more people are getting sick and we must work a little bit harder, and we're already stressed maximally. Happy because it shows the commitment of the government. Excuse me. Happy because it shows the commitment of the government of Antigua and Barbuda and the Ministry of Health to support us in the healthcare system as we work tirelessly in the only medical facility in the island. So if I were to go forward, what we have here, the Mount St. John Medical Center has a total of 185 beds by capacity. It has 140 beds clinically involved right now in the fight against COVID and every other disease that we have. We have presently in the hospital 46 confirmed cases of COVID-19. We have 9 cases suspected of COVID-19 since last night in the ER. And of these cases, we have 9 people who are severely ill. There are 6 people in the ICU right now. All of them are vented, and all of them are extremely ill, requiring an awful lot of time. There are 3 other people who are on the ward on the brink of requiring ICU care with no form of ICU bed capability right now in the hospital, so we'll have to make room for them someplace else. The hospital right now has a COVID ward that consists of 33 beds. The ICU has six beds. The IDC has 17 beds. The maternity ward has 2 beds, and now the NTTC 13 beds dedicated to us at Mount St. John. If you're doing the math, this adds up to 71 beds capable of taking care of COVID patients in the hospital system. Believe it or not, every single COVID patient in the hospital requires about a 5 or 6 man team, not including doctors, to manage them. It involves the cleaners, the nurses, the ward assistants, and the orderlies. So it's a very hefty task. When you talk to the doctors, every morning the medical team that consists of 5 consultants and 6 house officers are charged to take care of these patients in the hospital, a monumental task. The emergency room at the present time is divided, where 2/3 of the emergency room is dedicated for COVID patients and suspect COVID patients. And what that does, it takes a strain on the other diseases that we must treat on an ongoing basis in the hospital. Presently, we were forced to cancel elective surgeries and only do emergency surgeries. And at the same time, we were pretty much forced to curtail most of the activities in the hospital system that does not have anything to do with COVID or emergent care. Laboratory services to the public has been halted, so has radiology services. So this is the report of what we're doing every single day in the hospital. It's a real Herculean task, and I tell you, I want to thank almost all of the people involved in this care. The emergency room, they're seeing battered and bruised every time you go there. And when I walk in, they seem more battered and bruised because they think I'm bringing more bad news or I'm bringing more patients. Yeah. So I try not to walk in there too often. But they're stressed maximally. The ICU ward is chaos with care. Every single room, something happening all the time. Management of the patients in the ICU beds, whether you have to turn them over, or you have to move them, or you have to adjust the ventilator, you have to get some blood drawn and so forth in order to manage these patients. So this is the task that we face. The role of this NTTC, we can start to move some patients around that could come to a place that is not as intensive as the hospital environment and allow them to get better with a little bit less staff required to take care of those patients. So in simple, I really want to thank the the government of Antigua and Barbuda under Prime Minister Gaston Brown, the Minister of Health, Wellness and Environment for their support. They never wavered. Contrary to what you hear from time to time, we have all the necessary PPEs that we can have or we would need that would last us if this pandemic goes on for the next 2 years. This has been going on now for 20 months. This situation with COVID has been going on for 20 months. The fatigue is on our faces, and we really would like to urge people to get vaccinated. But 95% of the people that we take care of now are not vaccinated. And you tell from the dashboard and everything else, in the last 3 days, we had 7 deaths. These were people who were very, very sick and took an awful lot of time. So from Mount St. John and myself, we want to thank all those who helped, the emergency room, the board, the ministry, and at the same time, we want to encourage the public to please get vaccinated so we won't have to take care of you. Thank you.